My name is Sridharan. I'm one of the orthopedic surgeons here in the Department of Orthopedics at Northern Lights Regional Hospital. I grew up in a small town in Alberta, and I've lived in Alberta my whole life, and the opportunity to come back as a surgeon in Alberta is the main reason I'm here. Yeah, the orthopedic surgery department here has 4 surgeons. We cover the full gamut of orthopedic surgery. We cover spine surgery, shoulder surgery, sports medicine surgery, hand and wrist surgery, and now we're actually starting a hip and knee replacement program as well. I grew up in a small town, and my wife and I are both in healthcare as well. I think local care is great because people don't have to travel to go see specialists. They don't have to risk traveling in our winter conditions that we have. And it's easier to recover for families when everything is close to home. You have that comfort and you have your family around you. And so for us, I think local care is very important. With crushing injuries, I think there's a couple of things. There's the immediate injury that this patient sustained, often broken bones or damaged structures. And one of the important parts is working in the emergency department with our emergency doctors, coordinating with our orthopedic team, coordinating with our nurses and our anesthetists in order to give them the safe surgery they need to repair their injuries. I think the second part is when you see a crushing injury as a surgeon, you know you're about to go on a long journey with that patient, and there can be setbacks and there can be a life-altering event to this person, and there's an emotional connection that has to happen as well in order to take them through that journey successfully. And I think the big thing is we don't do it alone. We rely on our physical therapists, our nurses on the floor, our social worker. Really everyone in the hospital in these big traumas plays a huge part in getting somebody back to their life that they had before this injury. One of the things we're privileged to be starting is a hip and knee replacement program here, and we're very excited to start that. Hip and knee replacements are incredible surgeries. They alleviate pain and they get people back to doing the things that they love. And to be able to do that locally, I think is going to be amazing for our community and a privilege for us as surgeons to be able to provide. I think without donors, we would not have the orthopedic program that we have right now. They've been instrumental in getting us the equipment we need to do the most modern surgeries possible, which allow patients to get home and do the surgery safer. They've been instrumental in really just allowing us to do what we do and not have to worry about equipment needs and where are things coming from. And that takes a lot of burden off of us and allows us to focus on our patients. I would say that I think all of us are really grateful to be part of this community, to provide the care that we get to provide. And as cheesy as it sounds, I think we're all just really happy to help. And we're very grateful to have the opportunity to be part of this community.
My name is Jennifer Sandmoen. So in January, my husband and I decided it would be a good idea to play pickleball. And we were running late and got down to MacDonald Island Park to meet our friends to play pickleball. And because we were running late, we didn't stretch. And so I ended up tearing my Achilles tendon about 85 to 90%. And I ended up in Emerge pretty much 10 minutes into the game. I assumed that our health center could only do so much with major or minor things. So I was always under the assumption that our health center could just do a few things here and there. I've been lucky enough in past years to help with the Festival of Trees and do volunteering with them. And so I always knew that in the back of my mind I would need these services at some point. Little did I know a pickleball injury would put me in the hospital. I was at the hospital a few times in Emerge. I went once, it was on a Sunday, so they weren't able to do an ultrasound. On the Monday, I went back, the ultrasound was done, and it was expressed to me that I had quite a severe injury, even though I didn't think I did. So I was lucky enough to have an awesome ER doc who referred me to an orthopedic surgeon, and within 5 days I had surgery on my Achilles tendon, which I thought would be a simple surgery, but clearly it was quite complicated. They actually have to take a cadaver tendon and put it in, and so it's quite a rehab. It's a major injury that I was surprised I could have treated up here in Fort McMurray. The services I've received through the hospital regarding the nurses and the physiotherapy have been nothing short of really quite miraculous. That there again, you think it's a small health center that can't sort of treat these sort of injuries, and they're absolutely treatable up here. The nurses were phenomenal. When it came to checking me in, I stayed overnight, to the morning of, to being wheeled in and getting ready to go in for surgery. I started to get quite nervous. I hadn't had a surgery in 16 years since I had my daughter. So I was quite nervous, and the nurses just put me at ease completely. They were laughing and joking as I was. That's kind of how I deal with things when I get nervous. And so it was actually a really comfortable environment. I think it's interesting because I had never seen anything like the Festival of Trees before I moved up to Fort McMurray. So if you're not familiar with the Festival of Trees, it's a 3-day event that raises quite a bit of money for the hospital. It's everything from an ugly sweater party to a luncheon to a gala. It's a boatload of fun. The room is stunningly beautiful when you walk in and see all these Christmas trees, and I was excited to help out with the fundraiser, not even in the back of my mind thinking that someday I might need the services of the hospital. I was lucky enough this last year to bring my daughter on to help, and we had so much fun. It's a wonderful weekend, and I think that people should really think, if they have the time, to put in, to make the event so special. When the event runs, you feel so grateful that you're able to be a part of such a magical weekend. I'm very grateful to all the past donors that helped make the hospital what it is. Without their donations, I definitely think I would have had to go out of town to get all these services. So I think it's so important that we keep going in the community and getting those donations so that we can make our center even better.
The ripe age 18, I thought I was unbeatable. I did not cross my mind for a minute that I would end up in an ICU room in this hospital for a week straight, barely being able to move. My name is William Oldford. I was in a work-related accident back in July of 2021, and I had a stay here at the Northern Lights Regional Hospital, and they saved my life and my leg. The healthcare heroes are definitely heroes. There's no doubt about that. They help people in the most dire situations when you seem like you've lost all hope. They're there, they help you and your friends and family there at the hospital with you to get through those situations. I don't have anything but praise for them, to say the least. Well, having a hospital and healthcare team in Fort McMurray as good as the team that's here, it saved my life. And it could save anyone else's life in this town, or they're out on site and they need something. This place is the place that is here for that. So I would say it's very important to me, and it should be important to everyone here because they can and will help you. Well, I'd like to express my deepest gratitude to Dr. Manilescu, his orthopedic team, and every other care member at this hospital, because they were there when I needed it and provided me with the best care I could imagine. And someday you might be in my shoes or in my work boots, and you won't know when you're going to need it. So just keep supporting the Northern Lights Health Foundation, Northern Lights Hospital, and just keep that in your mind. Keep your head on a swivel. You'll never know when you'll need it.